the real secret to a faster, better recovery from major surgery has nothing to do with what happens after the operation, but everything to do with what you do in the weeks before. Well, today we're diving into this incredible concept called prehab. And trust me, it's changing the game when it comes to preparing our bodies for a massive challenge. And look, everything we're breaking down today comes from a really sharp review by Dr. Reza Lankarani. He's a general surgeon, the founder of the Surgical Pioneering series, and he's on the editorial board for the Genesis Journal of Surgery and Medicine. So he's done all the heavy lifting, digging through the research, and we get to explore what he found. So just imagine this for a second. You've got a major operation on the calendar. Your mind is probably focused on the surgery itself, the hospital, what recovery is going to be like. But what if the single most important thing you could do for a better outcome actually starts right now, weeks before you even step foot in that hospital? Okay, so to really get why prehab is such a game changer, we first have to understand the enormous hurdle that patients and doctors are up against, especially when we're talking about certain types of cancer. We're going to zoom in on cancers of the upper gastrointestinal tract, so think stomach and esophagus. And these aren't some rare diseases. They are a massive health problem all around the world, with a lot of cases and often a really tough outlook. And to give you a sense of this scale, just look at this number. In 2022, in China alone, there were almost 360,000 new cases of gastric cancer. The sheer size of this problem is, well, it's just immense. And it doesn't stop there. For esophageal cancer, that same year, the number was over 200,000. When you see numbers like this, you really start to feel the weight of how many people are fighting this battle. Now, for so many of these patients, surgery is the best shot they've got. It's the main treatment. But, and this is a huge but, the physical toll of these surgeries is just enormous. It makes the recovery process itself a gigantic challenge for doctors and patients alike. So with that massive challenge laid out, this new idea has been picking up steam. It's called prehab. So what in the world is it? Let's break it down. Prehabilitation, or PR for short, is all about being proactive. The whole goal is to get a patient's body and mind into the best possible shape before they go through the stress of an operation. It's exactly like training for a marathon, except the marathon is your surgery and the recovery that comes after. And what's so cool about this is that it's not just one thing. Prehab is the whole package. We're talking about building muscle with strength training, getting your lungs stronger with respiratory rehab, boosting your heart and endurance with aerobic conditioning, making sure your body has the right fuel with nutritional support, and, just as important, getting your mind ready with psychological support. Okay, so this all sounds incredible in theory, right? But the million-dollar question is, does it actually work? Well, scientists decided to put it to the ultimate test, to find out for sure. They didn't just do another single study. No, they went bigger. They did what's called a meta-analysis. Just think of it as a study of studies. It's one of the most powerful things researchers can do because they pool together the data from lots of different trials to get one clear, super reliable answer. And this was no small task. The researchers pulled together and carefully analyzed the results from 16 different high-quality studies on this exact topic. We're talking top-tier stuff, like randomized controlled trials. And get this, across those 16 studies, they had data from over 2,000 patients. A sample size that big gives you so much more confidence that what you're seeing is real. This isn't just a fluke, it's a massive amount of data. And this slide really tells the story of how careful they were. I mean, look at this process. They started with over 1,000 articles. They screened hundreds for relevance, closely examined 30 of them, and then, only then, did they boil it down to the 16 best of the best studies that met their super strict standards. That's how you find the real truth in a sea of information. All right, so after all that, all the searching, the filtering, the number crunching, what was the final verdict? What did this massive study of studies actually tell us? The results were pretty fascinating and really clear. For patients who went through prehab, 3 huge benefits jumped out. First, their hospital stays were significantly shorter. Second, their risk of getting pneumonia after surgery went down. And third, their physical endurance, measured by how far they could walk in 6 minutes, got a whole lot better. Now, it didn't fix everything, but in these key recovery areas, it made a huge difference. Let's just look at this in black and white. The definite wins are huge. Patients get home sooner, they have fewer dangerous lung complications, and they're physically stronger. Now, on the flip side, prehab didn't really move the needle on things like the overall rate of all complications or wound infections. It's a nuanced result, you know? It shows that prehab is an incredibly powerful tool, but it's not a magic bullet for everything. So we've seen the data, we've seen the science, but what does this actually mean for a real person, for a family going through this? This is the part that really matters. When you boil it all down, past all the stats and the jargon, the message is so simple and so powerful. Patients who did prehab got to go home to their families sooner. They came out of surgery with more strength, more energy, and a lower chance of a really scary lung complication. I mean, that's a life-changing impact. And hey, you don't have to just take my word for it. This is a direct quote right from the study's conclusion. The scientists themselves put it plainly: prehab reduces lung complications and shortens the time spent in the hospital. You can't get a clearer endorsement than that. And this all leaves us with this really exciting, provocative question. With evidence this compelling, are we looking at a future where getting fit for surgery is no longer just a nice suggestion, but a core standard part of cancer treatment for everybody? And bringing these critical findings to light is all thanks to the profound review and hard work of Dr. Reza Lankarani. So if this got you thinking and you want to dive even deeper into the science, you can find a lot more detail in the Surgical Pioneering application. The link is right there on your screen. Thanks so much for tuning in.